What do you think the international reaction in general, both American and global, to the coronavirus has been? I mean, there has been some criticism with the initial shutdown of some of the flights, direct flights to China. Obviously, the information has been, in some cases, spotty.
Yeah. I think it's an understandable process. Since the beginning, was a lot of people worry, a lot of people don't know what's the cause of it and how quickly it gets spread. But now it seems that I think it's fairly under control. It's in China, except at the epicenter of Wuhan, the rest of the country is declined, the new cases. And also the cured cases is increasing now. There's almost 7,000 cases being cured. And also the death rate is also not high as SARS. I mean, it's only 2%. I think things should be gradually under control. But also this thing is very strange that normally goes with the weather. I mean, like SARS, it also started in November, December, and then by the next year in the springtime when weather gets hot. It also a situation gets better. So I think there's things can be done.
So one of the most disturbing pieces of news around expansion of coronavirus has been some of these first responders. I mean, of course, we know that the doctor that originally blew the whistle on the coronavirus and was reprimanded for it, ended up dying from it. But now some 1,500 early responders have themselves caught coronavirus, in part because they haven't been as well taken care of as they needed to. How's the Chinese government going to respond to this? Clearly, it's a problem.
Yeah, I think there's some reasons to probably causes that. Because first, when this the virus broke out, people have no lack of knowledge, even medical staff. So there's quite a bit of interaction there, and that probably gets some people infected. Second is that the protective equipment is not enough, like the mask, the clothes. Those are not in good supply. China was on spring Chinese New Year holiday. There was no supply, and then there was a lack of those kind of protective equipment. That caused some of that. But I think now as China goes back to work, and then international also support comes in, we have a lot of countries donating medical equipment and all those things. That's really helped. So I think these numbers should cut down.